65 years old. I'm still active in my career. I'm married, father of 6, and the grandfather of 3. And the demands of my world require a very active lifestyle.
So Mr. Gentry came and saw us about 5 years ago, and at that point he had spinal stenosis. So he had severe pinching of his nerves, and it was causing him to have severe leg pain.
I had really tried a lot of alternative methods.
Physical therapy, anti-inflammatories, medications, injections. He did everything that he could to avoid surgery.
I really wanted a more permanent solution, so that was when I decided to go ahead and have the back surgery. After hearing about Renaissance and the procedure and the success that had already been accomplished through this procedure, we decided to go ahead and do it.
The torque of a golf swing puts tremendous stresses on the back and then the lumbar spine.
I was a little left.
The disc at L23 on Mr. Gentry had severely deteriorated, and it was crushing the nerves coming out of this area.
It was very difficult for me to swing a golf club. When you get to the top, you can't, cock it well.
Before surgery, we sit in front of the computer with the CAT scan, and it allows us to have a definitive plan before we even walk into the operating room. On the operating room table, through a small incision, we attach the robot to the patient. Once the robot's attached to the patient, an X-ray is obtained, and then we calibrate what the X-ray is of the patient at that moment with what the CAT scan had showed a couple of days or a couple of weeks before. Once the robot is attached to an anatomic location on the body, then we know where our positions are in the body, and the robot tells us the rest.
Okay, we need left L2.
The robot slowly moves to the right side of the patient, the right angle for the screw, and the right location for the screw. It gives us a beep that tells us that it's set, and it tells us what attachments to use. Through that attachment, a stab incision is made through the skin. The drill guide is passed through that stab incision and attached and docked onto the bone. Once it's docked onto the bone, a pilot hole is made, and through that pilot hole we pass our guide wire, and then we were able to pass the screw over the guide wire and to its final position. The doctor is still putting the screws into the patient. The robot is guiding our hands. So if something doesn't look right, we're able to abort that procedure. I've not had to abort the procedure, and I've not had a misplaced screw yet. So Mr. Gentry had, instead of opening up the back and taking out all the bone back here and cleaning up the nerves and then restabilizing with screws and rods, so that would have been a bigger incision with much more muscle dissection, we were able, in a minimally invasive direction, coming from the side and put in the spacer into the disc space to jack up the disc space and restore the height. So that was the first step, and then we were able to go from the back using 4 different poke holes. We were able to, through the skin, put a guide wire through each of the areas that we normally would put the screws, and then over the guide wire we would put a percutaneous screw to stabilize that segment.
Right after the surgery, the first week was pretty tough, just like any surgery when this occurs. But I'm kind of proud of the fact that 2 weeks to the day after surgery, I was back in the gym. And I actually took a little selfie for some proof that I was in there.
Less than a year out from his surgery now, and he's back playing golf and he's back to work.
It's sort of a badge of honor for me right now to be able to say that I can walk 18 holes and carry my bag.
This is sort of the next step in the revolution of doing things minimally invasively. We're able to minimize the radiation, we're able to minimize the OR time, and we're able to achieve the same minimally invasive goals with much higher accuracy.
I'm just very excited about where I am right now physically. You know, in the past, there have been a lot of stories about unsuccessful back surgery, and I think it's important for people to understand that with the technologies that are employed through the Renaissance system, and certainly when you're using a good doctor, that the chances of your success are very high.